Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the research and general director of the institute, and we are here doing another podcast on a Friday afternoon. How are you, doctor?
I'm very well. Happy that it's Friday, but doing doing really well. Always happy to be here with you, Luis.
All right. Thank you, doctor. We are going to talk about how the stem cells can help children with autism. Is that correct?
That's correct. Yep, absolutely.
So I do have a few questions for you, doctor. I was wondering how the autism is actually diagnosed. What are the early signs of that?
Yes. Yeah. So basically, autism is diagnosed with certain characteristics in behavioral patterns, like difficulty in transitions with children, something new in the routine, or a new food that they're adverse to for whatever reason, not necessarily the taste, but it's just out of the norm. And so transitions and changes, they react to inability, in many cases, inability to make eye contact, a little bit removed from emotions. So sometimes there's lack of empathy. And so children tend to be, it's not easy for children with autism to make friends. And those are, and then lack of affection in many cases also. Again, they're just sort of removed from their emotions. For instance, one of a patient earlier on in my career, the mother actually called us up a few weeks after treatment because her 5-year-old son, for the first time, told her, "I love you." And so these are the types of so these are the types of things that we encounter. And so these are the types of characteristics. Not all children, depending on where they are on the spectrum, because it is quite a spectrum. There's sort of very high functioning and then low functioning and then anything in between. So depending on where they are on the spectrum, there will be signs and symptoms of autism accordingly.
Okay. And in this case, I was wondering if this autism is genetic. Is it genetic, doctor?
Yes, that's the theory. What I feel is that there is a genetic predisposition, but not always is autism manifested, even if there is a genetic predisposition, because I believe that there's something in the environment combined with that genetic predisposition that manifests as autism, and in many times that environmental trigger isn't present. And so there's still that genetic predisposition, but autism does not exist or manifest in that specific individual. So I consider it sort of a lock and key. If that key fits into the lock, we get autism. The lock is always there. The key is not always there.
I see.
So I hope that makes sense. That's my theory.
Totally. We're gonna get into the main topic here: how these stem cells can actually help children with autism.
Oh yes. So we believe that it is our belief at the Stem Cell Healing Institute that autism is not a disease. It is a neurodiversity. It's a different way that the child thinks, behaves, perceives the world. That is not necessarily pathological. which, in other words, it's not necessarily a disease. It's just diversity. It's just a different way of being. And so, what we see in changes in children with autism, and it's more about a quality of life. And see we see children changing in their behaviors, in their transitions, going from one activity to another. There's the less of a propensity for a tantrum or an outburst, or acting out. The ability to be more affectionate, the ability to make more friends because they relate to their friends better and their friends relate to them better. We've seen children that eat a diverse array of foods when before treatment they were only eating maybe a handful of foods and just over and over again, the same foods over and over again. Um, what else have we seen with children? Oh, the eye contact. Those are some of the biggest changes, also verbal. We have seen children, there's one specific, more recent, we had seen going at the age of 5, going from completely nonverbal to within 6 months of treatment, he was talking. And not full sentences, but words. And so we're tracking his progress. So it's very exciting.
Which type of stem cells do you use for children with autism, doctor?
My preference is propagated bone marrow stem cells combined with endometrial stem cells. However, we will also use umbilical cord, whatever we feel is necessary and the most appropriate for the child. So it those. We also do adipose-derived stem cells, which are also adult stem cells. We don't do those as often, but we do have that available.
And I believe you do have a lot of have treated a lot of children with autism, but there is like a one testimonial. I don't remember which one, but there is one testimonial on your YouTube channel of one of the mothers, right?
That's right.
I believe her name was Rita, wasn't it?
Well, yes, Rita, and her son Ryder.
Yeah, you should. If you're listening to this podcast and you wanna see this testimonial, you can go to our YouTube channel, and you can see that testimonial. It's very emotional. It's very nice.
Thank you for mentioning that, Louise. With Rita's son Ryder, he was also suffering. Another characteristic of autism is echolalia. Echolalia is when the child hears a word or a phrase and they keep repeating it over and over again, and hence the name of the word echolalia. And that was a very, very common symptom or characteristic with Ryder. And that was one of the first things that Rita noticed was diminishing, was the echolalia with Ryder. And at this point in his life, the echolalia does not exist. Another thing she noticed with him was the transitions were a lot smoother, without outbursts and tantrums. And that was another one that was a big one with Ryder.
That's amazing. And that must have been very exciting for her. I cannot imagine being a parent and see that your autistic children is having some improvements. But what other improvements, besides the ones you already mentioned with Ryder, can we expect from after this stem cell treatment?
Oh, yes. So, as I mentioned, Louise, the transitions being smoother, being open to new things, new foods, new experiences, new environments, also eye contact, behavioral issues in schools and with making friends with other children. All of these things we've seen improvements in with various children with autism.
Can you tell us what is the work that the stem cells actually do in the brain of these children?
Yes, so we don't even know exactly what's going on in the brain of of children with autism, but what we do see are these improvements. So we believe that the neuronal junctions are functioning better and being nourished with the stem cells, and basically regenerating and maybe repairing in a way in order for behavior to be addressed, nonverbal to verbal, social interactions, and executive decision making. And all of these things are improved because the neurons are just firing and functioning better.
Are there any tests that need to be done before they arrive to Guatemala? I say arrive because we are located in Guatemala.
That's
In
right.
case you're coming from anywhere else, is there any tests
Yes.
that need to be done before they come?
Yeah, so what we do a nice, full, thorough screening. We take a full history before they come. We also have the patient do blood tests, the key blood tests that look for specifics for the stem cells and then just general good health. We look for certain viruses, certain things that could affect a person with autism or any disease for that matter, any specifics that we're looking for. And we ensure that everything checks out before they get to Guatemala because we wouldn't want them to get there and we have to refuse them for whatever reason. So we do have to approve their candidacy for the treatment.
Okay. I am going to mention that in case you come to Guatemala, we can provide everything from a driver, an Airbnb type of facilities, and we can also suggest some one-day trips, right, doctor? They can do if they come to Guatemala.
That's right. We can make arrangements for day trips and to all the various landmarks and Antigua and whatever they feel is for them. We have volcanoes and coffee farms and ruins and just a beautiful touristic place. Guatemala is.
And also, we have a big zoo in the city, so that's another highlight of the city, if they want to
That's
go.
right. I forget to mention the zoo. It's quite an amazing, vast array of the animals of the world. So in my opinion, it's one of the best zoos I've actually seen, and they do a really good job upkeeping it.
Yeah. So, doctor, I always ask you: is there anything else you would like to add to this podcast?
No, I think you've covered so much ground. We've mentioned in past podcasts about the comprehensiveness of the treatment with everything involved from nutritional detox to oxygen therapy to age appropriate growth hormone therapy and stem cell enhancement, herbs and minerals, and then of course psychological and emotional well-being is something else that we address, and so that sort of covers everything in terms of the comprehensiveness and wellness as a whole, because wellness is not just our body, it is everything encompassing our mental, psychological, and spiritual health as well. So we address everything.
Okay, thank you, doctor. If you want to contact Dr. Figueredo, we're going to leave all the information at the last part of this podcast and also all the information about our social media. And so there's a lot of ways that you can contact the Stem Cell Healing Institute or Dr. Figueredo. We appreciate your time and we will see you on the next podcast, which is going to be autoimmune diseases. Thank you for listening and have a great weekend, doctor.
Thank you, Louise. You too. You deserve it.
Thank you. If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.